For individuals taking blood thinners, particularly vitamin K antagonists like warfarin, the question of whether foods such as blackberries are safe often causes concern. Since blackberries contain vitamin K, it's natural to wonder if they might interfere with medication effectiveness. The truth is that blackberries can be safely included in the diet, even for those on anticoagulant therapy, as long as vitamin K intake is managed with consistency and awareness. The key is not avoiding vitamin K altogether, but maintaining a steady intake that allows medications to work as intended. Vitamin K plays a crucial role in blood clotting by supporting the activation of clotting factors. Warfarin and similar anticoagulants work by partially inhibiting this process, reducing the risk of clots that could lead to stroke or deep vein thrombosis. Because vitamin K directly affects this pathway, sudden changes in its consumption can alter the drug's effectiveness. Eating a large amount of vitamin K rich food inconsistently, such as suddenly increasing leafy green vegetables or supplementing heavily, can reduce the efficacy of the blood thinner, while a drastic drop in intake can lead to excessive thinning and bleeding risk. Blackberries do contain vitamin K, but in moderate amounts, approximately 28 micrograms per cup, which is significantly less than what's found in kale, spinach, or collard greens. For most individuals on blood thinners, this level of vitamin K is not inherently dangerous. The issue arises only when intake is irregular. If blackberries are eaten consistently, such as a daily or every other day serving, they can be safely factored into the medication plan. In fact, stable intake of foods like blackberries may even be preferable to complete avoidance, as it supports a more natural, nutrient-rich diet and allows for a broader range of beneficial phytochemicals to be consumed. Consistent blackberry consumption also offers cardiovascular and anti-inflammatory benefits that may complement the goals of anticoagulant therapy. Their polyphenol, fiber, and antioxidants support healthy blood vessels and may reduce oxidative stress, a known contributor to clot formation. This makes them a particularly smart fruit choice for individuals already managing heart disease or stroke risk. However, communication with a healthcare provider is essential. When starting warfarin or adjusting dosage, it's helpful to let your doctor or dietitian know how often you consume vitamin K containing foods like blackberries. Monitoring blood levels through INR, International Normalized Ratio, testing helps ensure the medication remains effective and safe, even with consistent dietary vitamin K. It's also important not to confuse the moderate vitamin K content in blackberries with high-risk foods. Compared to leafy greens or certain green juices, blackberries are unlikely to cause significant fluctuation unless consumed erratically in large quantities. And for those on newer anticoagulants like apixaban, Eliquis, or rivaroxaban, Xarelto, which are not vitamin K dependent, the concern about blackberry intake is generally minimal to non-existent. Ultimately, blackberries can absolutely be part of a safe and healthy diet for individuals on blood thinners, as long as the intake is steady and predictable. Avoiding them altogether is unnecessary and may deprive the body of valuable nutrients that support overall vascular health. With mindful planning and proper medical oversight, blackberries offer both flavor and function, even in the context of anticoagulant therapy.